My dear friends, after a long time, I am uploading this video just to see how I am doing Phaco surgery under topical anesthesia in a deaf and dumb patient. This patient is 44-year female who is deaf and dumb, who is not following my command, and even after that, I successfully conducted this catheter surgery. After staining the lens capsule by 0.6% trypan blue dye, now I am making the rexes of adequate size by using this band tip steel keratome. This cataract is almost grade 3 to 4 nuclear sclerosis. After removing this lens capsule, I am injecting 2% HPMC, and then I will make a main port by using this 2.8 steel keratome. Since patient is not able to see and patient is not able to listen, that's why I have dragged that eye inferiorly and then make a main port. Now, after doing hydro procedures, I am rotating this nucleus by using this lens dialer. This free rotation indicate there is no any corticocapsular additions. Inject 2% HPMC again, and now start the phacoemulsification surgery. In this case, I have adjusted the phaco needle tip size slightly larger than the other cases. In this patient, I am using modified direct chop technique, in which first I emulsify some superficial cortex and then I make a trench of adequate depth. After making this trench of adequate depth, rotate the nucleus about 90 degree and then again embed the phaco tip and chop this piece into two heminuclei. Again rotate about 90 degree and then chop it. Thus, I have made 4 quadrant of that nucleus. Now, I will emulsify each quadrant one by one by bringing it from the periphery to the center. Since this patient is not commanding my follow order, that's why microscope is slightly decentered, and I just don't want to lose my concentration and I don't want to remove my phaco needle. That's why continuously I have completed this surgery. This is the last piece which I am emulsifying. Always emulsify nuclear pieces in the center, not at the periphery. This one is the last fragment. After emulsifying this nucleus, now go to the US3 mode and remove this epinuclear plate See how I'm trying to catch this margin of the epinuclear plate. I'm trying repeatedly. Just see after a few seconds how I have catched that epinuclear plate and separated it from the posterior capsule or capsular bag, and then by using the vacuum, I'm not using Phaco energy at this time. I'm taking it by means of vacuum. See how I am doing this. This epinuclear plate has been emulsified, and now I will remove the remaining cortex by using this Phaco cannula. Inject HPMC and spread 2% HPMC over the corneal surface so as to improve the or enhance the visualization. Now, this is 23 gauge Phaco cannula. I am removing this subincisional cortex by going through right sided side port, and this cortex is being removed by using main port. Now the entire cortex has been removed. Now patient is ready to implant the IOL. There is no any cortical fiber over the lens capsular surface. Inject HPMC, and then I'm implanting this hydrophobic spheric lens of Germany, that is City Lucia Carl G's lens. Implant the IOL in such a way that the leading haptic should go into the capsular bag, and then dial the trailing haptics by using this lens dialer. Now lens is in the bag. Remove entire HPMC thoroughly. Don't leave any part of HPMC inside the anterior chamber. I am very much cautious about this HPMC since the patient is not able to speak and not able to listen. How she will complain about the pain post-operatively? That's why I have used this irrigation aspiration cannula for removing the HPMC completely. See that jet flow coming out from the irrigation port is very fast, and now there is no any HPMC inside the anterior chamber. Now I am injecting 0.1%, 0.1 ml pilocarpine, preservative free moxifloxacin, and then hydrated the both side port, and thus surgery is concluded. Thank you very much for watching this video, and your suggestions are always welcome.